Let's now turn to a medical expert for a more in-depth diagnosis on the current issues surrounding the latest on COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you again for joining us.
Thank you for having me.
We're back from a long Chuseok holiday here in South Korea, but with many people traveling, concerns have been raised over a potential hike in new infections. And in fact, the highest daily caseload for Saturdays, Sundays, Mondays, and Tuesdays was recorded over the holidays. How do you expect the situation to unfold?
There are four worrisome indices that I'm looking at. First of all, unfortunately, we went into the Chuseok holiday with an uptick of daily average cases in the Seoul metropolitan area. There was a 12% increase in daily average cases. In the non-Seoul metropolitan area, it was a 16% increase in daily average cases. Furthermore, as was mentioned, the mobility data show that people are on the move. And of course, over the holidays, the number of vaccines that were delivered was very low. Also, I'm very concerned about the increasing number of cases of unknown epidemiological link. That number now is greater than 9,500, making up about 40% of all the cases that were diagnosed over the last 2 weeks. And so I think we will see over the next 2 weeks, as people go in for more testing, there will likely be an increase in the number of daily average cases.
Mm-hmm. Well, like you said, there are concerns over a rise in new infections following the holidays. But previously, the government planned to ease COVID-19 restrictions after October rather, when 70% of the population gets fully vaccinated. First, can you remind us about the current vaccination rate, and do you think we could reach that goal by the end of October?
Right now, 71% of the population has received at least one shot, and 43.2% of the population is fully immunized. If we wanted to reach a goal of more than 70% of the population fully immunized by the end of October, that means over the next 5 weeks, there are about 14 million people or 14 million doses that will need to be delivered. So roughly that's a little less than 3 million doses delivered per week over the next 5 weeks, which is a very ambitious goal. So I'm not exactly sure that we'll be able to reach that goal by the end of October, but certainly, we need to keep up the momentum. Now that people are off of the holidays, I think we need to resume with high vaccination rates.
Mm-hmm. Oh, well, now, given the situation, do you think it could be okay or safe to ease COVID-19 restrictions by the time we reach that goal? Like, what do we have to worry about?
Right. I think that some restrictions could be eased, but of course, the two concerns are making sure that our children are protected because they will not have received any vaccine. And one concern is there seems to be an increase in the number of people older than 60 who are getting infected. And this is a troublesome trend because, of course, they are at highest risk of developing severe COVID-19. There has been a major push to secure more ICU and hospital beds for COVID patients. Right now, overall in the country, there are 468 ICU beds available, but there are some provinces, for example, Jeju Island, they only have 6 ICU beds available for COVID patients. And so that's very concerning because if they were to have a huge outbreak, they could be in a situation where they are not able to take care of adequately all of the cases that are diagnosed.
So we should take a more cautious approach, rather. Well, breakthrough infections are also on the rise, with nearly 6,000 cases having been reported in the country. Now, this means around 40 people out of 100,000 who've been fully vaccinated got infected with COVID-19. Why are we seeing such an increase, and what can vaccination guarantee for us?
Right, so we're seeing an increase in the absolute number of cases, but the rate is still very low. It's 0.04% overall. the highest percentage of breakthrough cases is occurring in the age 30s demographic. And I think this reflects just the social and active nature of this age group. Even though they're vaccinated, they're out and about, socializing, working, active, whereas perhaps the older population, they are taking more precautions and they have the ability to stay at home because they don't have to go out and work and socialize. In terms of, is it worth getting vaccinated? Of course it is. In Korea, they just released vaccine effectiveness data, real population data. In terms of protection against critical and severe disease, there was a 77% vaccine effectiveness. In terms of preventing death, it's a 74% vaccine effectiveness. So most definitely, everyone needs to get vaccinated. But I think the message is, even if you are vaccinated, you should still be careful.
All right. It's time for us to wrap up our discussion for this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Dr. Tan, thank you again so much for your wonderful insights. We'll see you again next week.
Thank you.